And yeah, so I'll just go on to the first slide there. Oops, there we go. So we've got Rosie and John. Take it away, guys.
Um, I'll start us off. So, kia ora, everybody. My name's Rosie. I'm currently in my third year of medical school, and I'm up at the University of Auckland. I originally came from down in the South Island, a little place called Timaru, but I made the move up to Auckland to start university. Yeah.
And then it comes on to me. Hello, everyone. I'm John Clemance. I'm a third year medical student at the University of Otago. I originally was brought up in Tauranga, and I spend the majority of my holidays these days up in Wanganui these days. So yeah, that's us. All right. So going on to wanting to be a doctor and kind of what it just a general idea of what exactly is going on. So it's a 6 year degree in each place. So each year you do one first year of a placement in Hausai is how it works in Otago, and then you have two courses in Auckland. You have Hausai and I can't remember the top of the other one. Rosie would know. What's the other one? You have
Biomedical
Hausai.
science.
There you go. Perfect. And then you have a UCAT test, which is uh, it's not as hard as people typically say it is. It's more the time pressure that makes it challenging. The questions aren't that hard. It's just the time that makes it challenging. And there's a lot to it. But the biggest thing about it, which is the amazing thing, is opportunities you get doing it, the people you interact with, and just no matter what you do, in whatever sort of field you end up doing, you use healthcare as something you interact with, no matter what. You have a family member that interacts with healthcare, you interact with healthcare. It's kind of a unavoidable path in a way. So it's great to have a deeper insight into it. Yeah.
Awesome. So, like John just said, for Auckland, it's a little bit different. You've got two separate pathways to get in. So, you either do a first year in health sciences, or you can do your first year in a Bachelor of Science or biomedical science, is the more specific one. And they're a little bit different. They kind of depend on what your preferences are in terms of study. Health science tends to be a little bit more essay focused, and a little bit more about like determinants of health and like socioeconomic conditions. And then the biomedical science is a little bit more biomedical, and that's a little bit more exam based. So it kind of depends on which you prefer. We definitely get questions all the time about what one should I do, what one's better. They both give you a completely equal chance of getting in, and they're generally very similar. You take the same core papers, so it's just your little extra ones that are a bit different. But yeah, so once you do your first year, you move into your preclinical years, which is what I'm currently doing at the moment. So you do second and third year, pretty much lecture based and labs and tutorial based at university. So that's up in Auckland on the Grafton campus, which you can see in the photo, which is right opposite the hospital, which is pretty cool. And then after that, you head out for 3 years on placement in the hospitals. So Auckland and Otago do it a little bit differently. We kind of have a lot of clinical sites, and you can go to a lot of different places. Whereas Otago, you kind of pick one of three main regions. But yeah, Auckland's options are obviously the three big hospitals in Auckland, down in Hamilton, out Tauranga way, Taranaki, and up in Northland as well. So there's heaps of options. Selection requirements. So yeah, GPA from it's actually not your best seven, that's Otago's, but GPA from your four core papers, and then the other ones kind of you should still try and do really well in them because they matter for some of the other clinical pathways. And yeah, UCAT and an MMI for Auckland, which is nowhere near as scary as you think it might be. It's just basically a Zoom interview, a couple different stations, and they ask you some interesting questions about your personality and like how you interact with people, and then some like ethical scenarios. Yeah, and then Auckland has a lot of equity pathways. So if you're Māori or Pacific, there's a MAPAS scheme, which is awesome. They're really supportive and they help you through your first year as well. for most of you guys, I'm assuming you'll be regional rural, so you'll qualify for that pathway. And then there's other ones like low socioeconomic and students with disabilities. Yeah,
Yeah, for me down in Otago, it's pretty much a lot of it's the same, to be fair. It's your GPA from the top seven, so a lot of people typically have a paper that's not their strongest suit, so you'll take a optional eighth paper that kind of replaces your other one. But from the ELM years, 2 years, then your 3 years of ALM, which is your later years of like clinical experience. And you have UCAT, which is threshold, but there's no interview for house side, which is if you're not very good with talking to people, it's a good choice. It's you can just focus on your studies and not have to worry too much about how you have to portray yourself. I don't know. Could be a benefit. And they also have the same equity pathways as what you have in Auckland as well, which you guys would under the rural pathway, most likely. And there's a few other ones there as well. But yeah.
awesome. So the first 3 years, kind of like we've mentioned, you're based at university. And it's very similar to a lot of other science degrees. So you do all your lectures, you go through all of the modules of the body, kind of in sections, and it's lots of time on campus, lots of time in class, and then you also get to do some really cool labs, and obviously lectures and tutorials, small group work, yeah, all of that. And so you do labs, so you do like human anatomy labs where you get to do dissections. You also do like clinical skills sort of labs where you learn, your things like how to take blood pressure and how to like check people's, reflexes, all sorts of things. Um, and yeah, because medicine's such a massive cohort, you're usually split into groups and you often get really close with the group of students that you're working with, which is awesome.
Yes, and then what most of us all look forward to after you've done your ELM years, it's the clinical years. It's kind of where all the excitement kind of begins. It's like, what do I want to do? Do I have something in mind? And is something that I actually have in mind something I actually want to do? It's learning from people hands-on, interacting with patients, and you're finally, I know it sounds kind of weird, but when you spend 3 years at uni, you reach that point where you're in clinical years now, or even more, some postgrads you're like excited to get out there and interact with patients and kind of use your knowledge. And it's all about applying it now rather than sitting for an exam, which is just amazing. And then some of the things and people you meet, and you get a massive range of experience, which is very helpful. And just kind of touch on some of the other things that happen in medical school that you don't really get a grasp of, as just the like opportunities you get with once you kind of start, you can do research, you can have go under a supervisor's wing and pretty much like, for example, one research that recently was done for an Auckland based was one of my friends. He did a glaucoma research and implemented a new drug, which is a massive thing. It has massive influence on people in everyday life. And you're able to start doing that already when you're like not even there, which I think is just so amazing. So I thought I would just throw it in there as well. But yeah.
Yeah, and once you've graduated medical school, you've done your full 6 years. You do 2 years, which are called PGY1 and PGY2, where you are officially a doctor. You get to see your own patients, which is awesome. But you still report quite a lot to consultants, higher ups. You kind of do a similar sort of rotation system as you do in medical school. You rotate through some specialties. You get to pick generally the ones that you're really interested in. And then after PGY2 is when a lot of people start applying for specialties. So you can apply for like GP college or surgery college. Yeah, there's heaps of options. Awesome. So I think this section's just a little bit about us and why we've ended up in medicine. For me, so I came from Timaru, which is semi-small, not that small town down in the South Island. I moved up to Auckland, which was a big move, a little bit crazy. But I kind of wanted a bit of a change, and Auckland was really just fascinating, very different from small town. So I moved up. I didn't really initially plan on doing medicine, but I knew that I loved science and I really enjoyed connecting with people. So I decided I was going to study I was going to do biomedical science. So yeah, I took the biomedical science route into medicine. And I decided I was going to do that and then, figure out what I was going to do after that. And I absolutely loved my first year of study. And so in the end, I decided that I thought medicine would be a really, really good fit for me. The main reasons for that were probably just the people side of medicine. I just love, you know, getting to know people, hearing their life stories, and helping make, their lives a little bit better, which is always really valuable to be a part of someone's journey with their health. Obviously, the science is really fascinating. The human body is one of the coolest things ever. And so that's amazing to learn all about that. I also love the fact that for medicine, you don't have to specialize really early on. So for a lot of other health careers, you go into them and you're like, I'm going to do this one job. Whereas with medicine, you can pretty much do anything. You can do so many things. And so I really liked the idea that I didn't have to think about what to specialize in for at least 6 years. And that was really cool to me. And with medicine as well, there's heaps of hands-on work. That's something that's really valuable to me as well. And yeah, once you get into medicine, like John was saying, there's so many amazing options. So these are some photos of me in medical school. I do a lot of rural health stuff, which is amazing. So I do some research in rural health, which is awesome. I teach some undergraduate courses, which is also really cool. I teach the second year medical students this year as well, which is amazing. And I'm on the Grassroots Executive, which is our rural health club. And so, yeah, medicine's not just about study. There's so many options. And some of these are some of our really cool trips that we've done, like the Rural Health Conference. Um, one of the photos is of me in my volunteering role that I do at Starship, where I just play with the kids in the evenings, which is amazing. But yeah, medicine is awesome. I would highly recommend it. It's such a cool field, and it's so valuable to be part of people's lives. Yeah,
Yeah. Oh, I think that's a very perfect overview of what Rosie just said there. It's definitely just the people. The people you meet, the things you get to do is definitely the reason why I chose it. I I was in a position when I was growing up that I kind of knew I wanted to do it since I was quite little. Would have been in college. I was fully committed. I was like, okay, I'll go and do this, and I'll go and do it at Otago. Don't. So I that's kind of set me down on the route, and then I had some amazing people and friends around that support you to this time. And I think that's probably the biggest thing is the people medicine because you're all there for very similar reasons. It's there to help people, support people, and be kind of there at the front line in people's need. So you interact with people that are like-minded. You're in a amazing situation where it's all focused around the patient and it's all about developing your skills hands-on and applying the knowledge that I don't know. I did think kind of a side tangent, I'll go for a little tangent. Um, it was either finance or medicine for me. And as you can see in finance, you're not applying your knowledge for kind of a massive benefit of others, and you can't see that immediate kind of outcome that you can with medicine. That medicine, you're at that front line, you're just entirely immersed amongst it. So I thought I'd compare one, this consideration I did have. But yeah, one of the photos there on the top left was me at a research kind of speech competition, which was quite a great opportunity to do. On the right there was at our CCW, which is in Dunedin. You go to a rural area. I was lucky enough to get Queenstown, so it was quite a cool trip. We got to go on top of the snow and see well, not good, see some injuries and how they kind of deal with those on top of the mountain. So that was quite an amazing thing. But it's definitely the people, the people. Yeah.
amazing.
Mhm.
So yeah, that was just a quick little summary of what medicine is for both of us. So you guys, I think Emily said you submitted some questions when you signed up. So what we'll do is we'll just run through those questions that we've got here, and then I think we'll do some live questions if anyone has anything that's come to mind. So I'll see if I can answer the first one. So what is uni life really like, and how can I prepare for my first year? So uni life is awesome. It's a little bit different to school because you get a lot more autonomy with what you're doing. There's generally it's a lot more on you to do your study. Some people love that, some people don't. And yeah, you meet so many people, and because unis are so massive, you really get to find the people that you connect with. So I've met some of my best friends through university and through medicine, which has been amazing. In terms of how can you prepare for your first year, I think the only thing I would say is to make sure you've got a really good grasp of your high school subjects, especially your sciences. A lot of people get like really panicked and they feel like they need to pre-learn some of the first year stuff, but honestly, I wouldn't worry about that. I would make sure your summer's a nice break. And yeah, catch up on any subjects you've missed if you need to. Like I know we went through high school at a time that was COVID, so my teachers didn't teach some of the papers at NCA level. So I went through and just caught up on some of that. But other than that, I just relaxed for the summer because uni's a big adjustment, and it's important to be in a good headspace for moving into that. Yeah. See if John has anything to add. Otherwise, we can give
No,
the next few a go.
I think that's pretty good. I think I'll move on to the second one. I think because the second one ties in quite nicely as well here. Was is the first year how science hard? I've heard this. I think that's probably one thing that comes up like time and time again. And it's like in a weird way, like fear mongering. It's like it's not as hard as people make it out to be. It's totally doable. Hundreds of people do it like every year. It's completely doable. It's not far out of reach. It's like even the programs are designed for you to get into certain careers. These certain numbers sound kind of crazy at the time, but when you're in there at the moment, it's highly achievable. And kind of how you prepare for it, I think generally just having a good break, having some time and trying to find a good balance before going is probably the biggest thing because you don't want to be doing all this work beforehand, then get into your first year and be like, oh my God, I have to keep doing work because you're just going to reach a point where you don't want to do it anymore. And what keeps you doing things is enjoyment. That's the only reason why you study for so long, like let's say, medicine for 6 years. The only reason you're going to do that is if you really enjoy it. So yeah, I think that answers that one. Is anything you want to add to that one, Rosie?
I don't think so. I think the only thing I would say is the university wants you to succeed. And so they're really good with their support through that if you do find it hard as well. Yeah, but in terms of high school subjects, this is another question people ask a lot. Definitely your sciences, especially at level two. Um, if it helps anyone, I didn't take biology at level three. That's not a major one. But chemistry and physics are definitely really helpful because some of the papers that people tend to find a little bit tricky are the chemistry and physics papers. So it's really good to have a good knowledge of those subjects. And then just in general, with your communication skills, it's really good to take an English or an English rich subject. So I took history right through NCEA, and then as well your maths. So a statistics or a calculus, it really doesn't matter. It depends on which you enjoy. Genuinely, like, don't take subjects that you're gonna hate and then do poorly in because you don't enjoy them. And then on top of that, if you have space, take some things that you love. Like if you really enjoy music, definitely make space for that in your timetable. Yeah.
Yeah. Well, I'll move on to the next one. Biggest challenges medical students face. Oh, um, I think it's kind of maybe an adjustment would be the biggest thing we kind of face because you go from a year of like highly competitive-ish thing, like you're competing against each other to now you're all quite friendly together. I think some people find that difficult to adjust to. And it's all about like uplifting now, where in house I unfortunately there's quite a lot of competitive nature, so people aren't the nicest. And then you go from that sort of learning when they like tell you exactly what you need to know to now in medical school where you're getting kind of referred to as a fire hose. So you've gone from being drip fed to being a fire hydrant, and they just kind of opened it up, and there's all this information coming at you, and you're trying to just kind of grasp a few things that you're going through. And I think that can definitely be overwhelming for some people, and that's quite a big challenge. But that's kind of definitely why it comes back to like managing the workload, which flows on to the next question is having that balance, having that time where you're like, okay, I'm going to the gym. I finish at this time every night, no matter what sort of thing I'm going to do, and having time for your friends and your family, because that at the end of the day is most important. Studies can come and go, but your family and friends don't.
Yeah. Amazing. Yeah, those are really good answers. In terms of workload, yeah, just keep on top of it, and make space for the things that matter to you, definitely. In terms of a typical day, so obviously both of us are in our pre-clinical years, so we're still at university. So it looks like what most university courses will look like, to be honest. You have a couple of lectures a day, you have in your week, you'll have a couple of labs and then a couple of maybe clinical skills sessions. It really depends on the week. Medicine is very flexible, and I know for us up in Auckland, our timetable is like never consistent. So you have to like check it every morning and make sure you know what's going on. Um, but at the moment, what I would say I have is generally 3 or 4 lectures a day, and they're often on the same topic, which is really nice. And then I'll have some breaks in between where I can do a little bit of study or just hang out with my friends. And then, yeah, a couple of times a week we'll have a clinical skills session or a lab or something like that. And yeah, small group activities where we, practice our history taking, all sorts of things. It's very varied. But yeah, it is a high contact timetable compared to some other degrees. We definitely have a lot of lectures compared to a lot of my friends.
No, I totally agree. That would be pretty much the same for here. Just that our timetable's normally pretty consistent, unfortunately, which is good. Oh, unfortunately, not unfortunately, fortunately. Yeah. So going on to the next one, do you actually get work-life balance in a medical career? Um, it's kind of it's kind of hard to answer that question entirely because we haven't gone into our clinical years yet, so we don't have an exact grasp of what that's like. But from what we've had in the last like few years, definitely, you definitely do get a work-life balance. I think you need a work-life balance if that kind of makes sense, because it kind of just re-energizes you, keeps you going. It's when you connect with those people and you go and do things that's a little bit outside of the medical field, it's just kind of reignites that fire that and desire you want to do things, if that kind of makes sense. Yeah.
Yeah.
Anything you want to add, Rosie?
No, I think that's a perfect answer. It's kind of what you make of it. So if you want to have a work-life balance, you can definitely make that happen. And again, depends on the specialty as well. Yeah. So after 6 years of med school, can you work straight away as a doctor? The answer to that is yes, you can. So once you graduate medical school, you're officially a doctor. You take care of your own patients. But because doctors have this kind of hierarchy system. There's always going to be someone above you until you're like, maybe when you're 50, you might be like the top dog. But yeah, as a junior doctor, you are officially seeing your own patients, you're making diagnoses, you're admitting people, you're giving people treatment. But there is always people that you can ask questions to. So yeah, you're officially a doctor, but you're still learning, and medical training they always say is like lifelong learning. So even when you're 50 or 60, you're still learning new things every day, which is really cool.
Yes. And then which university is best for studying medicine? Oh, I think me and Rosie might have conflicting opinions on this one. I don't think it really matters though, at the end of the day. It's just where you have the most support. So would probably be my answer. If you have family and friends in Dunedin or something like that, some people would choose that as their support, or some people just want a entirely different change and totally different scenery, totally different vibe. And then, you know, I don't know. I think it'd be what works best for you and what's important to you.
Yeah, absolutely. It's definitely up to you, and no one can really tell you the answer to that question, because everyone's values will be totally different. The next question, the last question actually, can you easily move between different health career pathways if your interests change? So this kind of it's similar to changing between other university degrees. It's definitely possible. It's a little bit tricky. It's a little bit of admin work, but you definitely can do it. And a lot of people, you'll notice once you get to uni and get to medical school, a lot of people come into medical school from other health careers. So a decent chunk of my class has done something else before they started medical school. That might be an undergraduate degree in like physiology or pharmacology or something cool like that. But some people honestly like do a career and then come into medicine. So there's heaps of options. Like people have done nursing for like 10 years and then come in. One of my friends was a pharmacist before they came in. Yeah, there's heaps of options and it's definitely flexible. Yeah.
Yeah, no, I think they answered that question perfectly, to be fair.
Okay, so thank you so much, guys. What we're going to do now is open the floor to questions from the group. So if you guys want to pop your questions in the chat, please. Don't be shy, ask whatever, and John and Rosie will do their best to answer it. And I just thought while we're sort of waiting for those questions to come through, I'll just ask you guys some kind of questions that have been asked in past webinars, just to sort of get the ball rolling a bit with that. But yeah, please put them in the chat and I'll read them out. So some of this has sort of already been covered. So when it comes to moving away from home for uni, would you say that that's kind of a factor that would kind of influence you? You wouldn't want to be too far from home, or is it sort of something that drives you? What's it kind of like moving away from home?
I think it's quite funny because I think both John and I have done the opposite things.
Yeah.
I grew up in the South Island and went to Auckland, and John was from the North Island and went to Dunedin. So both of us moved quite far away. But I think a lot of people generally tend to go closer to home. I know for Auckland, a lot of the cohort is from Auckland just because it's such a massive city. But it kind of depends. I mean, I still get to see my family just as much as a lot of my friends that in Dunedin do. I fly home. It's a little bit expensive, but it's possible. With all the great Air New Zealand and Jetstar. Yeah. So I guess it really depends. I've really enjoyed being in Auckland. It is definitely hard to be away from home. But I'm excited. You can also in sixth year you can do a swap. So that is potentially my plan is to do my sixth year down in Dunedin's kind of catchment area, which will be interesting. Yeah.
Cool. Yeah,
No.
sweet. Thank you so much for that. Anything to add on that one, John?
Um, yeah, I don't know. Kind of for me, I entirely agree with Rosie. How can I get as far away from my parents as possible? I wanted to be in my own little realm and, focus in on it and just be that kind of thing. Because I thought if I was in Auckland, being only 2 hours away, I would just like drive home or stay at home too much and wouldn't really like get involved with the uni life. So that's why I actually went away from home. So you try and this kind of forces you to make friends, connect with people, and I know just get just more engaged. I know if that makes sense, but there you go. Yeah.
Yeah, that does make sense. Cool. Thank you for that insight. We've got a couple of questions in the chat now. So, someone's asking how much advantage is there to coming from a rural school? I'm assuming it's like maybe you feel disadvantaged because you've come from a rural area, sort of something along those lines. I think maybe Rosie, you're from Timaru, so would you like to sort of start this off? Because I
Yeah,
think some people in this webinar are from South Canterbury as well.
oh, yay, South Canterbury. I love it down there. It's very cool. Yeah, so in terms of that, I think there's definitely things that you'll notice when you move to a big city that my schooling was not the same as everyone else's. I moved to Auckland and everyone was like, what like curriculum did you study at high school? And I was like, what? And they were like, did you do Cambridge? And I was like, what is that? So that was definitely a big shock moving up. I was like, oh, people like didn't do NCEA. And my school definitely taught, like, didn't teach some subjects or didn't teach some papers. So that was tricky. But definitely, if you're the sort of person that loves learning and they teach you everything at uni, pretty much from the very basics. So you really aren't missing out on much. Coming from a rural school. In terms of advantage, yeah, you guys, if you're from a rural school, will qualify for the rural admission pathway, which is awesome. And that does it, you kind of get ranked separately to the general applicants. So you're on a different list for admission. And there's a certain like number of students that they have to take from rural areas, which is awesome. So it generally changes what the scores that you need to get in, not majorly, just a little bit, but it can be really helpful. And once you're in medical school, if you do decide that that's the route that you want to go, there's so much support. I know that Auckland has, in the last couple of years, brought in a lot of support for rural students. I'm involved in a lot of that now, which is really cool. So there's tutorials, there's like we get together as a group, there's like a rural stream. So I'm in a stream with a whole bunch of other students who are also from rural areas, which is amazing. And there's the student support staff specifically for rural students. So there's heaps of really cool initiatives that they've started for students that they know are often far away from home, and often find uni a little bit scarier to make that big move than someone who's, coming to uni from Auckland and they're going like 5 minutes down the road from their house. Yeah, so that's just a few little insights. I hope that kind of answered that one.
Sweet. Yeah, no, that's really good. John, did you have anything to add to that at all?
No, no, I thought that was perfectly articulated.
Yeah, awesome. Nice job, Rosie. Yeah, so somebody is asking, what are some qualities and skills that are needed to be successful within medicine? I know we've slightly covered this, but maybe sort of a little bit more in depth if possible.
Right, okay, I'll start us off then. So qualities and skills. Resilience, one would probably be one of your big qualities. Uh, oh, I know it's kind of everyone brings their own unique qualities and all sorts of things. That's what makes medicine, I know, like amazing as it is. You have everyone with these different qualities, different interests. It's like, why do people want to be certain specialists? Because everyone kind of brings on their own unique character. No one's the same, which I think adds to the amazing of it. But I think resilience is one that kind of always comes up and would be probably the one big thing that would lead to success in medicine. And there's a thing that we refer to in medical school is referred to as a growth mindset instead of a fixed mindset. This is referred to a few times, and this is referring to that if you get something wrong, it's not the end of the world. Like you're going to get things wrong. You have to move on, and it's all about how can I improve this, come back again, instead of beating yourself up about it. Because realistically, errors are going to happen, and you just have to move on in a creative way. Be one of the big ones.
Sweet. Yeah, no, really good. Definitely resilience. I didn't study med myself, but I do have a lot of friends who went in to study med, and a lot of them say it is a lot of perseverance, resilience, determination, things along that line. So you do have to really push yourself as well. Rosie, did you have anything to add on to that one?
Ooh. I think one of the other things that I would add is just like a general enjoyment of learning because there's so much content just flying at you all the time, that just enjoying learning new things is a really important thing to have. So if you're just someone that loves science, loves learning about how the world around you works, I think it's really cool. And then in terms of the people skills for being a doctor, you definitely have to enjoy talking to people, be able to connect with quite a wide range of people because you're going to see so many different people in the hospital. But that is also something that they help you with developing once you're in medical school as well. So they give you a lot of support with, how do you go about having hard conversations that you often have to have as a doctor. Yeah.
Nice. Awesome. Sort of along those lines, someone's asking, are there any extracurriculars in terms of activities that you suggest we should do? So maybe like they're thinking along the lines of something like sport related or something like this, to sort of give you that insight. But yeah, if you guys
Um,
had any answers.
yeah, I think in terms of like you might often see that overseas, like they want you to have extracurriculars. It's not really the same case in New Zealand. It's not a requirement to get into medical school, but it's definitely very important for that work-life balance that John was talking about before. I definitely think it's important to have things outside of medicine that you also love. So I play a lot of music, and that's really important to me, and that's like how I relax when things get a little bit stressful. But a lot of my friends, yeah, they play sport or they do some volunteering or a whole bunch of things pretty much. But yeah, it's just those things that you can use to give yourself a break from the chaos of university, are really important. And I think it's really important for everyone, no matter what you end up doing. Yeah.
Yeah. No, I fully agree. Yeah, anything, whether it be the gym or just something that fills your cup up, kind of rejuvenates you and gives you a little bit of time away. Like me and my friends typically regularly do like a games night or a movie night together or something like that. And it just gives you a select time where you're doing nothing, not doing nothing, you're not studying and you're doing something with other people that's enjoyable and kind of exciting. I don't think extracurriculars need to be based on building a CV like you have in the US, for example, a lot of the time.
Yeah, absolutely. Yeah, we've got quite a few questions coming through. So someone's asking, is finding that study socialized balance difficult in the first year? So there is quite a lot of discourse kind of around this of first year being really, really hard. I'm sort of picking up. So yeah, what do you guys think about that one?
Um, in the first year, I will admit that because of the whole idea that it's really, really difficult, and you get told all this kind of information that's really, really hard, you have to get really, really high grades, and you have this, as I said, this fear mongering that kind of happens. That does make it hard for you to like make those decisions that, okay, I'm going to set this time aside and I don't need to study. But realistically, you find later on when you like going through your study journey that there's times where you're efficient and there's times where you're not efficient, where you should have just gone and spent some time doing something else. And you're going to reach a point where you don't want to, not want to, no, not going to want to do it anymore. Whereas if you took an hour off that day to go and do something you really wanted to do, and then you only have 2 hours instead of those 4 hours, maybe, but you'll get just as much work done in those 2 hours as what you would in the four. It's a lot of the time just the fear of going to do it sometimes, and it's you just have to do it.
Yeah, I don't really have anything to add to that one. It's definitely, I think it's important to always make space for, being a human being, rather than a human doing, that little quote that they like to say. Yeah, it's important to connect with people, and especially in medicine, that's such a big part of it that, yeah, you just can't study all the time. You'll burn out, and it makes your first year much more enjoyable if you do take time for yourself and time for the people around you.
Yeah, sort of a similar question in the chat as well is asking about how you stay motivated when the work gets very difficult. So I assume this is kind of all the way through your studies, work is going to get difficult sometimes. What's sort of the motivation for you guys?
I would say my biggest motivator is my friends, to be honest. Like, if I don't want to go to lectures, it's like, oh, my friends are going, so I'll see them there, which is a really good motivator, to be completely honest. It's a big social aspect of university is going to class or going to labs together. And so that's a really good reason. I like to, tell my friends, hey, like this week's really busy for me and I'm just like going through it. I might just need some motivation every now and then, which is awesome. So it's really good to have people around you that will give you that motivation when you're stuck. And the other thing I would say is like, take your breaks when you need them. I'm the sort of person that like, if I'm not getting things done and my brain's not working, I will give myself the space to like take that night off because you're not going to get anything done if you're not in the right headspace. So make sure you take breaks when your body is telling you to, definitely.
Yeah. I think, Jen, most of the stuff that we've kind of said of having your breaks, having people around you, and kind of some big motivators typically a lot of the time is actually your family as well. So just chatting to them, staying connected with people that you know and love, stuff like that. It's kind of a vital thing.
Yeah, sweet. So there's just one more question here, but feel free to keep asking them. We've still got 4 more minutes. So someone's asking, how hard is it to have a job and be in university at the same time? I'm assuming that's a part-time job to pay the bills while you're studying.
I'm probably probably a good person to answer this. I currently have three jobs. So that might give you some insight. They are all minor, but it definitely is possible. So I've worked right throughout medical school. I didn't work in my first year. And I think a lot of people don't work in first year, but I have worked both of my years of medicine. I do think it's a little bit more common up in Auckland to work, weirdly. Not sure what the reason is behind that, but a lot of my friends work. So I worked as an RA in halls. You'll probably meet them if you go to halls. They're kind of the older students that just like look after you and make sure, the transition to uni is going all right. And then this year I do two, a teaching job, a tutoring job, and a research position. So there's definitely space for that. I mean, I am a very busy person and I wouldn't 100% recommend it to everyone, but there definitely is. And I think there's some people that really do need to work, and there is space for that if you need to. But yeah, working also just gives me some other things to do. I mean, my jobs this year are kind of within university, but it's kind of gives you a little break from the study, different options. But yeah, it really depends on you as a person. If you think that you'll be able to do it, then totally. I would say don't work too many hours, because sometimes it gets a bit chaotic. But a little bit of work is totally fine. Yeah.
I think that's good. I wouldn't be able to add any more than that. That was great.
Perfect. All right, we'll do a couple speed questions. We're running out of time. It's just supposed to be 45 minutes. So someone's asking, are all of your friends in medicine?
No.
Definitely not. None
Yeah.
of my flatmates are at medical school.
Yeah, that's good. It's good to have a balance though, right? Otherwise, your entire life would be consumed by your degree. Sweet. So someone
Definitely.
is asking, what do universities look for in applications for medicine? For example, Duke of Edinburgh or grades? And if so, how high do they have to be?
I'll give a quick one. So you have your UCAT, which is kind of you have to be in a percentile, and then your grades themselves have to be at a certain threshold for a year. But it works off entirely based off the number ratio that was kind of mentioned earlier. So rural have a certain amount of placements that you kind of have allocated, and the general category also has a certain number of placements that you need. So the actual percentage you need or grades you need differs from year to year.
Yeah, it's totally dependent on the people that you're going through first year with, or also the postgraduates as well. In terms of things like Duke of Edinburgh, it's not specifically part of your application, but if you're applying for a course that has an MMI, like up in Auckland, some of that just life experience can be helpful for answering those questions. But again, for MMI, you get like a score from your responses. So it's very, yeah, like they rank you on a spreadsheet based on the numbers.
Cool. So I'm going to call this one the final question. And if anybody has any more questions, you all have my email. Just reach out to me and I can pass your request on to Rosie and John, or I can try answer it based on the best of my ability. But someone is asking how tight are the deadlines? I'm assuming with assignments and everything like this. That might also just be a general university question too.
That is off, Rosie?
Yeah, they're they're doable. I mean, uni's definitely much more full on than high school is, but you get used to it, and I think everyone's in the same boat, so everyone's going through the same sort of thing. But generally, if you're keeping on top of your work, they're very, very manageable. And I find that in medical school, there's less assignments than some of the other courses. For me, I don't know if it's the same in Otago. We tend to be a lot more exam heavy than assignment heavy. So you've got plenty of time to do your assignments, which is really nice. Yeah. Anything you would add?
No, I think just for Otago, we don't really have a lot during the year per se, because we have our big end of year exams, which has everything in it. So it's actually, in a way, kind of good as well, because you have time during the year to actually do what you want to do. And then towards the end of the year, you've got to be a bit more busy, but at least you've had a fun, enjoyable year up to that point. So yeah, but this deadlines aren't too strict. They're normally pretty lenient, and if life gets in the way, it's way more understanding as well, and there's support there for you as well if you need. So yeah.
Yeah, feel free to like reach out to your tutors and everything. I mean, obviously, I've been through university as well, and tutors are always there to help you out. And also, course coordinators are really helpful too. But yeah, we'll finish on that one. And like I said, just reach out to me at my email address. But thank you so, so much to Rosie and John for presenting with us tonight. We have a few more webinars happening for the rest of the week, so I might see some of you guys there. But yeah, thank you so much. And I
Nice.
hope everybody enjoys the rest of your evening.
Thank you so
Thank
much for
you.
all your great questions as well.
Absolutely. There's some really good questions. Cool. See you guys.
Bye bye.